Okay, good afternoon, friends. I welcome all of you in this annual training lecture series. So today we will discuss a very important topic, calibration. So we will discuss only relevant part, not in very depth, which is not relevant for you. We will discuss whatever is relevant for in our day-to-day laboratory activity. Okay, we have to understand what is calibration, why it is required, and how it is to be done. Sometimes people say calibration is heaven for us. If our equipments are well calibrated, well maintained, we can give correct results. Sometimes people say, oh, what is this? Unnecessary expenditure. We were running laboratory for last 30 years and suddenly when we started accreditation, so people started talking about this calibration. It is unnecessary expenditure, which is not good. See, if we visualize our laboratory, in 1950, what people used to say, this laboratory is a good laboratory. Why? In 1950, it is my laboratory. And I know what I'm doing. So you have to believe. Sometimes people used to, oh, that laboratory is run by Dr. So-and-so. So that is a big laboratory and it is in the biggest hospital in the country. You cannot challenge. All these things, trust me. And you have to trust because I'm pathologist, I'm microbiologist, I'm biochemist. Then the thought process changed. In 1960, they started saying, see, I only do good work. Or Dr. So-and-so only run good laboratory. My hospital only run good lab. And I have spent so much money in my laboratory. When I have spent so much money in my laboratory, which nobody else has spent, they have to believe this laboratory is a good laboratory. Then in 1980, people started saying, I am participating in quality control. I have defined my turnaround time. I am participating in EQUAS. Or all across the globe, people started saying, we are following accreditation requirement. Our laboratory is accredited, although at that time accreditation was not started in India. But now this 15189 is very well established standard. This 15189 was started in 2003. Then second edition, third edition, and this fourth edition is released only in the December 2022. And from 1st July onwards, NABL will also start accepting application as per this new standard. So now in this standard, they are talking about all these things: quality control, proficiency testing, quality indicators, accreditation visits, internal audit, management review, quality policies, standard operating procedures, document control. Now people are talking about all these things. And when we talk about our analytical part, what is the reason why we are saying our laboratory is good? Because of the proficiency of people. People who are working in the laboratory, they are competent. Competence means they are able to use acquired knowledge and skill in practical situation. Whatever reagents we are buying, these are of good quality. They have good stability. We are operating our equipment in a reliable condition. We have defined specificity and sensitivity of selected tests. We are selecting very good tests. We are following procedure correctly. We are running controls and everything is documented. We are keeping documentation of each and everything. And what is document? Any useful information on any suitable medium is called document. Now we are talking about equipment reliability. What is the basis of this? Equipment reliability, one of the important consideration is calibration. And how this calibration need to be defined? In simple words, calibration is method of ensuring the desired performance of a equipment. Now, if we say, what is the requirement of standard? The clause 6.5.2 of ISO 15189-2022 is talking about equipment calibration. Calibration is method of ensuring the desired performance of equipment. Now, what we need, one thing is, first we have to specify the calibration requirement. We are saying these equipment need calibration every 6 months. These equipment shall be calibrated once in 12 months. Whatever it is, we are specifying this calibration requirement, and we are also specifying these equipments will be calibrated in our laboratory, and for these equipment we will use the services of some calibration lab. For your non-analytical instruments, your pipettes, your thermometer, your centrifuge, you shall use a laboratory which is accredited. Now we are talking of calibration lab. You are selecting a calibration lab which is accredited as per 17025 for the calibration of that particular equipment. So for this, you collect their copy of accreditation certificate and copy of scope. With that, it is clear that laboratory is accredited. They have valid calibration, valid accreditation certificate, and also the equipment which you are sending to them is within the scope of their accreditation. All analytical equipments, your analyzers, these shall be calibrated with the help of calibrator. And this calibrator shall have metrological traceability. So now, what the standard is saying, whatever procedure you are mentioning, it should specify manufacturer instruction for calibration. Now, in this, if you're sending to a calibration lab, write one sentence, you're sending to calibration lab, which is following the requirement of 17025, and that is okay. But if you have biomedical engineer, you are carrying out calibration in your laboratory, then whatever manufacturer they are recommending, follow that. Record metrological traceability. Can anybody tell me what is metrological traceability? What is metrological traceability? Yes, uninterrupted chain of calibration. So I will explain you metrological traceability after reading these points. So in calibration, what is required, as I explained you, and one thing is you're getting your equipment calibrated, keep the record of this calibration, date of calibration, and wherever this calibration give rise to some correction factor, those shall be appropriately updated. Otherwise, you will not get correct result if you are not using those correction factors. And time to time, check also calibration of your equipment so that you're sure whatever equipment you are using, that will give you correct result. As I said, this equipment shall be calibrated either from the accredited laboratory, which is following 17025, or by the manufacturer or authorized distributor, your analyzers. If accredited lab is not present, NPL India, that is National Meteorological Institute, that is also applicable, or MRA partner. In India, major accreditation bodies NMEL. If they don't have any accredited laboratory which is calibrating that particular equipment, because here we are considering different type of equipment. But suppose that services are available with some other accredited laboratory, so you can take the service of that accredited laboratory, maybe within the country, maybe outside the country. Now, metrological traceability is we are using calibrators. Calibrators, they have fixed value. Our analyzers, they have light source. Then light passes through a colored solution, which you are preparing with the help of reagent. In this reagent, you are either adding this calibrator, because you have an light either in the calibrator or in the control or in the patient sample. You are adding calibrator, light is passing through it, then through filter and detected by the optical system, it generates some absorbance. Degree of absorbance is proportional to concentration of analyte in that solution. And you know the concentration of that analyte in that calibrator material. Suppose absorbance generated is 0.6 and concentration of the analyte is 100 milligram per dl. Suppose it is a calibrator glucose. After that, you are running control. If this control results are within acceptable limit, you are happy. The calibration is okay. After that, you are running unknown patient sample. So whatever results you are getting, suppose you are getting absorbance 0.9. You are saying this glucose level is 150. If it is 0.3, glucose level is 50. You are using the same formula which we read in biochemistry in our college days. Absorbance of test divided by absorbance calibrator into concentration of calibrator. Now, question is, what is the basis? How the value of that 100 is assigned to that calibrator material? If you're asking company people, they are saying it is based on some higher reference material. We analyze this calibrator as unknown sample 100 times or 150 times, and we provided mean value to this. Okay. What is the guarantee? Value of that reference material is correct. That was also analyzed based on further higher reference material. That way we are reaching to national international standard. This process by which our results are traceable through calibrator to national international standard through unbroken chain of comparison is called metrological traceability. These analytical systems, our analyzers, which are calibrated by manufacturer with the help of calibrator, shall be calibrated at least once in a year, or whatever manufacturer is recommending. Whether these are analyzers of meteorology or biochemistry or coagulation or an ELISA reader, these shall be calibrated at least once in 12 months. In-house calibration, sometimes we do for certain equipments, like we can calibrate our centrifuge with the help of tachometer. If we are getting one thermometer calibrated by a calibration lab, if we have biomedical engineer who are trained, they can calibrate other thermometer with the help of that calibrated thermometer. And you have to remember one thing, if you are getting your analyzers calibrated, this shall be done with the help of calibrator. Sometimes these company people, they come to us and they say, we have compared the results on your machine with the result on with very high-end machine. So now it is almost, it can be considered as calibration. No, calibrator should be with calibration should be with calibrators. How this interval is defined? See, one thing is whatever manufacturer is recommending. Then it depends on workload. If a laboratory is using a pipette for say 100 samples per day, another laboratory using 10 samples per day, so definitely wear and tear will be more who is using for 100 samples per day. And also ruggedness of the equipment, also life of the equipment, and quality of the equipment, and how efficiently you are carrying out maintenance of the equipment. These things also affect your calibration interval. So now what is required? You shall have established program of calibration and ensure traceability. When you are getting calibration certificate, so in this by accredited laboratory, then we said in analytical system, equipment reliability is important. And calibration is one of the important factor in equipment reliability. Then we discussed, this is mentioned in ISO 15189, clause 6.5.2. Then I explained what is the meaning of calibration as per the requirement of this international standard. So this calibration shall be done by a accredited laboratory. For your analyzers, at least once in 12 months, or if manufacturer is recommending frequent calibration, then get this equipment calibrated more frequently, but not later than once in 12 months. For in-house calibration, calibrate with the help of calibrator, not with control. Sometimes company people say, we have checked with control. No, that is not acceptable. And this also calibration interval, what are the factors affect this calibration interval? That also we discussed. And then we were discussing that you shall have metrological traceability and metrological traceability to highest possible order. Then our calibration certificate shall have symbol of the accreditation body and validity of the calibration, and also measurement uncertainty associated with that calibration. We have to check these things. See, examination errors are 100% preventable. Examination errors are 100% preventable when unbiased medical testing laboratory accreditation system is implemented. Whatever ISO 15189 is saying, if you understand why it is required in our laboratory, sometimes what happens, we start following this 15189, we want accreditation because we have to get few panels. For that accreditation is a requirement, or we want to, during COVID-19 time, we want to start this molecular testing, for this accreditation is required. So we are following, we are creating documents, but we have to understand 15189 is a document for developing quality management system, for improving quality management system in medical laboratory. So we have to follow this 15189 more intelligently, more diligently. And sometimes we get confused. What is the difference between standard and calibrator? Because when we were using in the beginning our semi-auto analyzer, so we used to say standard. Now we are saying calibrator. What is the difference between standard and calibrator? See, purpose is same, but standard. contains a weigh-in amount of substance that has been measured. If suppose you are saying creatinine standard is 2 milligram per dl, so in 100 ml you are adding 2 milligram creatinine. And it is aqueous based. In a calibrator, a analyte is measured by repeated assays. Then we take the mean value. And its matrix is similar to patient sample. And in standard, it has only one analyte. Calibrator may have multiple analytes. Standard doesn't have any metrological traceability. Calibrator has metrological traceability because it is assayed based on higher reference material. Then that higher reference material based on further higher reference material. And whatever you are doing in your laboratory, you're getting equipment calibrated. Keep raw data also with you. If you're getting raw data on thermal paper, get the Xerox copy of this. Because you believe in God. For everything else to believe, you need documentation. If you have not documented, so people will say you have not done it. What is the evidence? Everyone needs evidence. And generally, I get a lot of confusion regarding the understanding of this validation verification. How many of you know what is validation, what is verification? See, if you go by the definition, what is validation? Confirmation of plausibility for a specific intended use or application through the provision of objective evidence that specified requirements have been fulfilled. And what is verification? Confirmation of truthfulness through the provision of objective evidence that specified requirements have been fulfilled. If you try to understand by the definition, both definitions are more or less similar to each other. It is very difficult to understand. Am I right? Please write in the chat box. The definitions are confusing or simple to understand? Okay, so now we will understand these definitions. See, confirmation of plausibility for a specific intended use or application. You are suppose developing anyone who is microbiologist in the group, please write in the chat box. Any microbiologist in the group, please write in the chat box. No microbiologist. Okay, any pathologist? Please write in the chat box. I will not ask you what is validation, but I need your involvement. Neha Shah, please unmute yourself. Nazia Rashid, please unmute yourself. Hmm? Yes, Nazia, please unmute.
Yes, sir.
Ah,
Yes, sir.
okay. Nazia, please unmute yourself. Please unmute yourself. After unmuting, no, you are not unmuting yourself. After unmuting, remove cursor. Remove this pointer from there. Otherwise, you get muted again. Yes, Nazia. Now unmute yourself.
Yes, sir.
Okay. Yes, Neha, you also unmute yourself.
Yes, sir.
Yes,
Neha,
sir.
what is your specialty?
Sir, I have done my MD microbiology.
MD microbiology. And Nazia, you?
Sir, I am pathologist.
Okay. Now suppose Neha and Nazia, both of you think if we are using this Zenon staining for such a long period, we will develop our own stain, that is Anon stain. For that, what is the requirement? First thing is, what is the use? With that Anon stain, you want to identify acid-fast bacilli, right?
Yes, sir.
So specific intended use is you want to identify acid-fast bacilli.
Yes, sir.
Now, what is the requirement for this? To accept this as a reagent equivalent to Zn stain or maybe better than Zn stain. What is the requirement? You have to compare result with the Zn stain. In some cases where Zn is negative, you are comparing with molecular testing. You are comparing with culture, right?
Yes, sir.
Yes, sir.
So if suppose it is negative with Zn but positive with your stain and all, or if it is positive with your stain, so you can say your stain is more sensitive.
Sensitive.
And coming positive with this culture and molecular. So now whatever you are saying, that has some evidence. What is that? This is with this what you are developing objective evidence through these studies, through these specified requirements. What you are developing objective evidence, right?
Yes, sir.
Now plausibility means acceptable or reasonable. So your confirmation of plausibility, that means confirmation of acceptance of this Annan stain through provision of objective evidence that specified requirements have been fulfilled. You have compared the result with the existing methods, right? So this is what they are calling this as validation. Now, if suppose someone else want to use this thing, they are not claiming anything. They don't want to claim anything. If suppose they want to use your Annan stain, what they are checking? They are checking truthfulness of your statements, truthfulness of your test. They will also perform the same thing, but they are not developing any system. They are just confirming. They are just confirming whatever you have developed that has some meaning. So this is the difference between validation, verification. In validation, we make some claim after fulfilling the specified requirements related to that activity. In verification, we confirm the claim of someone else again after fulfilling specified requirements. Because with that, we are developing objective evidence. Thank you very much.